Do you know benefits of taking daily aspirin include the reduction of fever, mild to moderate pain, muscle aches, toothaches, common cold, arthritis, heart disease, and low blood pressure? Daily aspirin usage can help prevent a clot-related stroke and can also increase bleeding stroke. When arteries are already narrowed by the buildup of plaque, a clot can block a blood vessel and stop the flow of blood to the brain or heart. Taking aspirin diminishes the ability of your blood to clamp.
If it is advisable to take aspirin with alcohol, I would say no. There is no, in the first place, there's no advantage of taking aspirin with alcohol. And if you can avoid alcohol altogether, why not? That is highly recommended.
The daily use of low-dose aspirin can lower the risk of cardiovascular events in some people, mostly when they have chest pain or heart attack. In people with high-risk cardiovascular event, low-dose aspirin can prevent blood clots from forming. A doctor may recommend a low-dose aspirin for people who have high blood pressure, who have evidence of poor blood flow to the brain, people that have high cholesterol, people that have blood pressure that are high or low, or people that have diabetes, or people that smoke. As you can see, we have these arteries that are feeding the heart. When they are clogged, just like the picture you showed a minute ago, aspirin tend to remove those clots and allow blood to flow nicely. Also, this is the inside of the heart. And then aspirin will prevent clots from forming in this area of the heart, as well as this valve when they are deformed. So when these valves are deformed, you tend to form clots. So aspirin prevents all those type of clots from forming. However, people with other issues such as asthma needs to be careful when they take aspirin. Treating coronary events, or what we just described as vessels of blood that are clotted, one has to be very, very careful with aspirin. Doctors may administer aspirin immediately after a heart attack, after a stroke, or a cardiovascular event to prevent further clot formation or cardiac death. Aspirin can also be a part of a treatment plan for people that need revascularization surgery, such as angioplasty, coronary artery bypass, and a mini stroke. Other use of aspirin include rheumatoid arthritis, systemic lupus, and inflammation around the heart, which we call pericarditis. So aspirin can help prevent those kind of inflammation. Thank you.
Thank you, sir. Before we go to the next question, sir, I want you to quickly explain these pictures to us. We want to know what is the normal heart, how does this aspirin affect the heart? Okay, so let me pull out this picture, sir. So this, okay, this is the normal heart, right?
This is a normal vessel.
Okay.
You see the inside is very clean.
Okay.
There is no yellow stuff inside. It's very clean and it's very smooth.
Okay. So
that's a normal vessel that feeds the heart. And if you look at my heart here, this is the vessel that we're talking about. This is like a pipe that is carrying blood into the heart muscle.
Okay. Okay. So this one is the clean pipe.
Yes.
Okay.
This one is the clean pipe.
There's no blockage.
It carries food into the muscle of the heart, making the heart healthy and able to work properly.
Interesting. Okay. So I'm going to bring the other one. So this one is different from the one I showed before. So
Yeah, this is different from the one you showed. You could see the yellow inside the vessel is a cholesterol buildup. So since the cholesterol is building up, you see that the diameter of this vessel is now narrow. So the hole inside the vessel is narrow, is smaller, making blood flow to go down.
Okay. So this one, okay, it's still almost the same thing. This picture. Hello,
Okay.
sir. Yeah.
Yeah.
Yeah, it's still the same thing as the other one. So I'm going to show this. Yeah, go
This
ahead.
is the same thing as the other one, but you could see the cholesterol plaque breaking off, which is the dark spot. So when you see that dark spot, which is there's a ulcer inside that cholesterol area, which will now result blood to clot. So this is what aspirin prevents from this low flow and clot formation to stop.
Okay, so taking aspirin will stop this formation of cholesterol that is blocking the tube. It's like a tube that the blood flows through, and the cholesterol is about to block everything right now. The blood, you can see that the blood is coming down tiny in a very tiny.
Exactly, and then they will start clotting. They will start clotting if we don't take aspirin, and then if we don't address this cholesterol.
Okay, so I'm going to show this other picture. Okay, this one.
Okay,
So
this is a cholesterol that has ulcerated, that has opened up. So you see behind it is blood clot. You see behind the black spot is blood clots. So aspirin will prevent those clots. And then, as we said earlier on, aspirin is an anti-inflammatory. It will prevent inflammations of this inside, making things to run smooth. So in our next lecture, we're going to have a cardiologist who is going to talk more on this issue and what you need to do.
You know, you have fat deposits, and they keep building because of the kind of food we eat and some of the other medical conditions. Then when the fat bursts and the platelet come to form a plug, it's going to prevent blood from flowing to the heart. So what aspirin does, we call it anti-platelet. What it does is to make sure that the platelets are not able to come together. So in any event, the blood flow to the heart and to the brain is sustained. So that is basically how it works. It reduces a clot and also prevents a clot formation. Thank you.